At the end of the day, to get this vaccine, you and I would be face to face. We wouldn't be on Zoom. We'd be shaking each other's hands because we're vaccinated.
Springfield hopes to become part of the solution in the fight against COVID-19. Good evening and thanks for joining us tonight at 10. I'm Jesse Inman. Our David Chasnov spoke with 3 groups involved in that effort. David, talk to us about what you learned.
Well, Jesse, in late October, research group QPS will host a coronavirus vaccine trial. QPS will start its first of 8 COVID-19 vaccine trials on October 26th.
It's a very exciting vaccine that we're seeing, and we're looking forward to working on it with this, the folks here in Springfield.
Brenden Bourg says his team will vaccinate more than 100 volunteers.
We watch for anything post-dose, that would occur, such as irritation to the skin. We really take care of the volunteers and make sure that their safety is absolutely number one. It's an environment that's very controlled.
QPS requires volunteers to stay at its clinic for 10 days.
For stays, some pay very small, with $500 to $600, and some pay up to $8,000 to $9,000.
Volunteers must have 6 checkups afterwards. The age range depends on the study, but safety remains top priority.
Everybody is tested before they come in. We have to still kind of space everybody out. We have a risk mitigation in place. We provide them pretty much everything they need while they're in here.
Like catering, laundry, internet, TVs, and games.
We want you to feel at home as possible while you're here.
It's not just research companies looking for a solution. Local healthcare provider Cox Health hasn't done a vaccine trial yet, but is working on a clinical trial with the National Institutes of Health.
For what's called hyperimmune globulin, so that's concentrated COVID antibodies. That's a big deal. I'm working very hard to get us that trial because that'll be a unique therapy that intuitively makes sense.
Hyperimmune globulin is used for hepatitis B, chickenpox, and rabies.
We have good experience using that. It's fairly safe. We really need that for our patients.
Mercy Hospital awaits 2 pending vaccine opportunities.
Mercy Research leadership team has been actively searching, engaging in those inquiries. The vaccine trials that are available nationally are extremely competitive to be awarded.
Universities are usually selected as a research site, but Vice President of Mercy Research Joanne Levy makes her case for why community health organizations should be considered.
There is the opportunity and the advantage that these patients can be followed for a long period of time after their participation. They don't have to go elsewhere for their care.
And so far, Mercy has completed 6 COVID-19 research opportunities since the pandemic began. 15 research activities are currently underway, and 7 opportunities are pending.
Lots of people waiting for those results eagerly, David. Thanks.